Unit 3 Health, Safety and Welfare in a Fitness Environment. Emergency Procedures. Aim of the session: to gain an understanding of emergency procedures in a fitness environment. Learning outcomes. By the end of this session, you will be able to identify the types of emergencies that may occur in a fitness environment. Describe the roles that different staff and external services play during an emergency. Explain the importance of following emergency procedures calmly and correctly, and describe how to maintain the safety of people involved in typical emergencies, including children, older people, and disabled people. Examples of emergencies that may occur in a fitness environment. Number 1, accidents or injuries to members due to poor exercise technique or dropping weights, for example. Number 2, medical illnesses, for example, heart attack, strokes, diabetic episode, or asthma. Number 3, fires or chemical spillages or leaks. Accidents and sudden illnesses. Dependent upon any first aid qualifications held, the ability to deal with accidents or illnesses will vary greatly. However, the role of any fitness professional when facing an accident or emergency situation can be summarized using the acronym CALM. C. Calm yourself. A. Assess the situation. L. Locate assistance if available. And M. Make area safe. Emergency services should be called when casualty is unconscious, suspected head, neck, or spine injury, suspected fractures or severe dislocations, severe external bleeding, suspected internal injuries, serious medical problems such as heart attacks, asthma, and diabetic emergencies, or you feel unable to handle the situation yourself or the casualty's conditioning is worsening. Other emergency situations. The fitness professional should ensure they are familiar with their company's individual EAP when dealing with any emergency. It is vital that any such procedures are followed both calmly and correctly to ensure the safety of everyone within the fitness facility, avoid inflicting panic on others and to prevent further harm. As an employee, you cannot be held liable for harm if certain actions are not taken. The ideal course of action is followed since it would have been amalgamated by a qualified professional or professionals. Certain population groups may need special considerations. Number 1, children. Number 2, disabled. And number 3, elderly. Dealing with children during an emergency. When dealing with children during an emergency, the fitness professional should be aware that they express their feelings in different ways to that of an adult. Talking to them about what is happening, listening to their feelings, giving direct, short, and truthful answers to the specific questions, and avoiding trivializing their feelings will all help prevent panic. The instructor should also make every attempt to remain calm and positive, since their behavior will directly affect that of the child. Maintaining the safety of disabled people in an emergency. The procedure adopted in any particular circumstance will vary as to the needs of the disabled person, and the fitness professional should be familiar with any restrictions which may exist if evacuation of the building is required. Lifts are normally prohibited from use during an evacuation, and care must be taken when using stairs. When providing assistance on stairs, the guide should descend first, allowing the person following them to use their shoulder. Maintaining the safety of older people in an emergency. When an elderly person is limited in their movement capability, much of the same guidance as given for disabled people would apply. Aging is also associated with a gradual deterioration in both physiological and psychological functioning. It may therefore be prudent to identify a member of staff who could buddy up should it be considered necessary. Role of the emergency services. There are three services which are almost universally acknowledged as being core to the provision of emergency cover. Police, providing community safety and acting to reduce crime against persons and property. Fire and Rescue Service, providing community safety and acting to reduce crime against persons and property. And lastly, Emergency Medical Service, providing ambulances and staff to deal with medical emergencies. Learning outcomes. Can you now identify the types of emergencies that may occur in a fitness environment? Describe the roles that different staff and external services play during an emergency. Explain the importance of following emergency procedures calmly and correctly. Describe how to maintain the safety of people involved in typical emergencies, including children, older people, and disabled people.